Welcome to the Sage Women podcast, hosted by Melanie White and Dr. Nick Engera. We have real conversations with real women, health professionals, and coaches who share stories about perimenopause, menopause, and a range of women's health issues. Please subscribe so you get the latest updates every fortnight.
Today, we're talking about becoming a menopause ambassador to champion change in your workplace. Now, unless you've been living under a rock, you've probably heard all of the publicity and media attention that menopause is getting these days. We have people talking about their symptoms, good and bad. We have people talking about their experiences at work. We're hearing about people retiring early due to menopause symptoms, a lack of knowledge in the medical sector, and workplaces scrambling to figure out what to do about it. We are also seeing some changes, both locally and globally, on this front. The UK has been leading the way with policies and procedures around menopause, and including fines around discrimination. In Australia, at the time of publication of this podcast, this episode, we have a Senate inquiry into the impacts of menopause. And that's probably going to see some mandates for flexible work and reasonable adjustments in the workplace. So coming back to the concept of a menopause ambassador, obviously there are different levels of responsibility for employee well-being, and a workplace does have a responsibility to keep employees happy, healthy, and productive, particularly in the context of the codes of practice that are rolling out in terms of the psychosocial hazards. Also, an individual has responsibility for their own health and well-being. The trouble is, most people don't understand menopause, most organisations don't understand menopause, and therefore how to deal with it. And this is an important gap that I think a menopause ambassador can fill. They are somebody who has the skills and knowledge to provide really effective support to both individuals and organisations at this significant stage of life. If we think back to the days of parental leave, we probably had some HR people coming up with initiatives, campaigns, and policies to support women who are having babies and leaving work. And it's much the same sort of thing. The difference is that having a baby doesn't really have a stigma attached. Menopause does. Menopause is not well understood. People are bullied and harassed, challenged, and sometimes supported at work. But too many people don't understand enough about the impact of menopause to see it as a realistic issue. This is where the menopause ambassador can fit in. They are somebody who improves everybody in the workplace's understanding of menopause and its impact. They provide support for individuals and leaders, and they help organisations make shifts that really impact the way people work, to facilitate improved work design, to create a culture of health, to bring in best practice initiatives at the right time and in the right place. They also advocate for individuals who need support, and they drive positive change. And so, as you can tell, to excel in a role like being a menopause ambassador, you need to be well informed, you need to be approachable, and you need to be skilled at networking. You might have heard of some other terminology being used, and I'd like to explain what a menopause champion is and what a menopause ally is, because they're different roles but complementary to a menopause ambassador. Menopause champions and allies may not be formal roles. A champion is someone who supports individuals and actively promotes initiatives, including training within a company. A menopause ally is someone who may not be going through or may never go through menopause, but they're anybody in an organisation who offers assistance and a solidarity and links to resources. I really think that it's important to go in to the workplace at this level, because at the governance level, people that are running the company may be removed from the needs and wants of employees. And at the employee level, the grassroots level, people may not know what to do, what supports are available, or they may be too afraid to ask for help because they don't have psychological safety in the workplace, or because they feel that it's a stigmatized issue. A menopause ambassador can break those taboos by being the interface between leaders and workers. And then that begs the question, well, who can be a menopause ambassador? I think technically anybody can be, but you do need to have specific qualities. And it was interesting that recently somebody asked me this question. They said, there's someone in my team that would love to do your training. I wonder if it's okay to include them. And I said, sure. Well, they need to be the type of person that a colleague would go to for emotional support or a shoulder to cry on, someone who helps others with complex situations when they arise. They're known as that real helper type of person. They're empathetic and approachable. And really, that's what you need to be, or the skills that you need to develop to become a menopause ambassador. I think it's important to note that if you are a menopause ambassador, your role is not to fix people. It's not to give advice or to share your own story, because women experiencing menopause primarily at the outset need to be seen and heard. That's what they want. So being able to listen with empathy is a critical first step. And then, a bit like a traffic warden, pointing people in the direction of the right sorts of support and resources that they need. When you do this, when you become that person who provides a safe space for an individual, or who has perhaps a challenging conversation with a manager or a leader about what needs to be done, you're able to make a huge difference in a workplace. You can make a real difference for your colleagues by creating a more supportive and inclusive work environment. And in a role like this, where you're a central hub for so many different stakeholders, you're going to go through a lot of personal growth. You'll develop leadership skills and you'll enhance your communication and interpersonal skills. You'll also expand your network, because when you're in a role like this, you end up talking to a lot of people and you find like-minded individuals that build networks and support groups and champion a common cause. So there's a lot of energy and momentum around a role like this. And ultimately, you have a big organisational impact. You're improving not just employee wellbeing, but you're enhancing productivity and the retention of key staff. A lot of women at this age are thinking about whether to stay in their jobs or not. Nearly 26% are retiring early, on average 7 years early. And that's a huge cost to organisations. And in some cases, it can leave women financially vulnerable and without stability. I interviewed someone on this podcast a few months ago, and she talked about the fact that she loved her job but was bullied by younger women at work and left 6 years early, retired 6 years early. And that's a real travesty. It's such a shame, because she was such a great worker in that organisation and had been there a long time, and it was a big loss to the organisation. But also it harked to the fact that there just wasn't a supportive culture in her workplace. An ambassador could have a real impact in that kind of situation. It might mean that women can find a way to stay at work, but without the pressure of being expected to perform all of the tasks that they used to do, maybe becoming more flexible in the way they work, and that ambassador is liaising between a manager and the staff member. An ambassador could also be supporting that person through their journey, raising awareness in the workplace. And there are so many outcomes, positive outcomes that come from that. So if you're wondering about becoming a menopause ambassador, really there are 3 steps. Firstly, to educate yourself on menopause and its effect on women in the workplace. There is some really great evidence-based information coming out, and new papers are coming out all the time on new areas of research. Unfortunately, women have been poorly studied in the past, especially in terms of medications. So we really don't know a lot about women's health from a historical point of view. And your ability to discern which studies and which surveys and which papers are quality is really important if you're going to go that way. The other part is to start conversations. Be really curious. Talk to people that you work with. Talk to managers. Talk to leaders. Look for opportunities to change. Figure out what's not working. And doing that sort of thing really gives you the chance to expand into a more formal role of being that interpreter, that traffic director, that hub for information. Of course, as you can probably tell, there's a lot involved in that role. You need to have really good interpersonal skills, be able to have sensitive conversations, be able to have some difficult conversations, and link people to evidence-based information and also the right type of support for their needs. Working with people at different levels in an organisation. And that's why the third step to becoming a menopause ambassador is to seek training. Sage Women's Health offers training in this area, and we really believe in setting a high standard in terms of practical skills, because you can learn a lot in theory, but unless you have the practical skills, you'll be walking away from a training course not knowing what to do or how to apply things or how to handle different scenarios. So we do a lot of that in our training, but I guess if you're looking for a menopause ambassador training workshop, make sure that the content is comprehensive, really well referenced and based in best practice. And it should cover menopause, its symptoms and impacts. It should cover the skills required to support colleagues and managers. So there's a lot of communication styles and that sort of thing. How to have sensitive conversations, how to engage people, how to spot the signs of risk. And then there are the communication and advocacy skills and techniques that you need to learn. It's important to understand a range of techniques because every organisation is different. So what might work for one might be totally inappropriate for another. And that's why your training program should give you awareness of a range of things that you can do, not just one or two. It's not a cookie cutter thing. You should also be looking for the skills to implement, so the processes that you would follow to implement initiatives that will have a big impact. It's not about a big, expensive hoo-ha or a big, expensive campaign. Your workplace needs to have some really simple initiatives that are easy to scale and easy to understand. Your training should have plenty of opportunities for practical skills development. Also, the workshopping ideas, planning, and workplace review. You need to be very well connected with the needs of the workplace, and you need to know how to assess those needs. You'll also need resources and tools. They should be part of a training toolkit, a training course, because if you're going to go into your workplace having done a few hours worth of training in a workshop, you don't want to then have to go and build a whole bunch of tools and resources from scratch. There are plenty available for you to source. You just have to know where to get them. You also want to make sure that your training course has appropriately qualified and experienced trainers. And it's essential that you get a completion certificate, because otherwise, who will know that you've done the training? And you might be eligible for CPD for that. So there's a lot to think about there. It's really understanding that ambassadors have a huge opportunity to create more inclusive and supportive workplaces, that they can be an interface between leaders, managers, supports, and individuals and other workers, so that everybody can get on the same page, everybody can understand menopause and its impacts. Everybody can be more respectful and courteous and accommodating, and both organisations and individuals can figure out exactly what they can do, some simple things that they can do that will make the journey so much easier. I hope that's been a useful episode for you. If you would like to know more about the Menopause Ambassador program offered by Sage Women's Health, please get in contact with us. We will help you to put menopause on the map at your workplace. Thanks for being here, and we'll see you next time.